thank all of you for being with us today. I want to thank everybody who's watching us through this Zoom platform. I'm Dr. Silvia Costa. I'm the CEO of YWCA El Paso del Norte, the largest YWCA in the United States. I am really honored to have such a great panel today. The mission of the YWCA is to eliminate racism, empower women, and promote peace, justice, freedom, and dignity for all. And so part of that process is making sure that we have, that we deal with health inequities in our community. And so we started a seminar called Imagine Healthy Communities with Dr. Sadhna, who is here with us today. So let me begin first by talking about this partnership. About 2 years ago, we started a partnership, YWCA with WIMS, specifically to address health disparities in our community. Dr. Sadhna Sheta, who is one of our board members, really spearheaded this project. She was very passionate about talking about racial justice as it relates to health disparities. And so with that, I'd like to turn it over to our former board member, Dr. Sadhna Sheta. And also, not only is she a former board member, she is actually the past president of WIMS, and she's also an assistant professor of neonatology at Texas Tech University Health Sciences Center. Thank you so much for being with us today, and thank you for envisioning and thinking through this process so that we could have this Imagine Healthy Communities program, which you spearheaded when you were on our board. So thank you, Sadhna.
Oh, thank you, Sylvia, for that wonderful introduction. And I was honored to serve on the board. It's an amazing organization. And I was also honored to serve on the Women in Medicine and Science, which is a really good organization that tries to help women in medicine and science and translates to helping those in our community. And today it's my pleasure to introduce the panelists for this talk on COVID-19. The first person I'm going to introduce is Dr. Glenn Fennelly, who is our current professor and chair of pediatrics at Texas Tech University Health Sciences in the Paul L. Foster School of Medicine. Dr. Fennelly joined Texas Tech in August of 2020. He was formerly a professor and chair of pediatrics at Rutgers, New Jersey Medical School in Newark, New Jersey, where he also obtained his medical degree. He completed a residency in pediatrics and a fellowship in pediatric infectious disease at the Albert Einstein College of Medicine in the Bronx, New York, where he stayed on as professor and chief of pediatrics of infectious disease for close to 20 years. He received his master's in public health from Harvard School of Public Health. He's very well known. He has done a lot of work, most recently related to COVID-19 in children. He's volunteered with Doctors of the World USA in Mexico and Kosovo, and is currently vice president of their board, and has volunteered for several months to guide scale up of HIV treatments for children in Vietnam. His laboratory research has involved development of vaccines against HIV, measles, influenza, and TB in infants, and his clinical investigations have studied HIV therapy and immunity and novel vaccines in children. His work has been continuously funded by the NIH for over 20 years, and he's published over 80 peer-reviewed articles, book chapters, and abstracts. Here at Texas Tech, Dr. Fennelly is working to improve children's health through innovative research and educating the next generation of pediatricians and investigators. He's also committed to alignment between the School of Medicine, its partners, El Paso Children's Hospital, and the Hospitals of Providence, and with El Paso community pediatricians and families, with the goal of providing exceptional patient care, population health, and capturing new opportunities in the rapidly changing healthcare landscape. Then I am going to go next to introduce Wanda. Wanda Helgesen is the executive director of the BorderRac. She is, which is a regional advisory council that brings together pre-hospital and hospital partners to discuss emergency healthcare and disaster preparedness issues in far west Texas and southern New Mexico. Wanda earned her master's in nursing from the University of Texas at El Paso. She practiced clinically and administratively in critical care and emergency departments. Her administrative duties led to her involvement in hospital emergency planning as well as the local Metropolitan Medical Response System Steering Committee in El Paso. For the past several years, her focus has been on the regional emergency healthcare systems and the development of regional emergency preparedness plans to include the full continuum of healthcare from EMS to home health. Wanda serves on the Texas Governor's EMS and Trauma Advisory Council Disaster and Emergency Preparedness Committee and the Texas Disaster Medical System Steering Committee. She's presented at numerous conferences, including the Texas Hurricane Conference, the NAACHO Public Health Preparedness Summit, Region 11 Medical Reserves Corps Conference, Joint Commission Emergency Preparedness Conference, Texas Homeland Security, Radiology Volunteer Response Conference, as well as serving as a guest scholar at the University of Texas at El Paso School of Public Health and the College of Nursing. Wanda also really helped a lot with the preparedness and the EMS responses with the mass casualty shooting that happened last August. The next person that I'm going to introduce is Dr. Sarah Martin, who's an assistant professor and chief of the Division of Child and Adolescent Psychiatry. She's the CPNA and the TCH-ATT Medical Director in the Department of Psychiatry at Texas Tech. She began her journey at the University of California at Santa Cruz, where she completed a bachelor's degree. Soon after graduating, she served as a community service specialist in the Peace Corps for 2 years. Upon her return from the Peace Corps, Dr. Martin was awarded a health professional scholarship by the United States Army to attend Tulane School of Medicine, and subsequently completed her residency and fellowship at Walter Reed Army Medical Center. She was on active duty for 11 years, including a deployment to Camp Bucca, a detainee facility in Iraq. Dr. Martin completed her military service at Fort Bliss, which brought her to the wonderful city of El Paso. She is currently Chief of Child and Adolescent Psychiatry at Texas Tech and is developing the El Paso hub of the Texas Child Mental Health Care Continuum, a state public health initiative spanning 16 counties in West and Southwest Texas. Dr. Martin, thank you for your service. Jennifer Molokwu is Associate Professor, Director of Medical Student Education in the Department of Family and Community Medicine at Texas Tech. Dr. Molokwu is an Associate Professor in this department at Texas Tech in El Paso. After graduating from medical school in Nigeria, she moved to the United States and obtained a master's degree in public health at the University of Minnesota School of Public Health, and a concentration in maternal and child health epidemiology. She joined the faculty at Texas Tech following the completion of her residency training in family medicine at Hennepin County Medical Center in Minneapolis, Minnesota. She's currently involved in clinical research teaching at undergraduate and the graduate medical level, as well as clinical practice. Thank you all for agreeing to be part of this panel, and I'm going to turn it over to Sylvia.
Thank you, Dr. Sadna Sheda. We really appreciate everything that you do for our community and everything that you've done to bring this together. As you all know, we have had a very difficult several months, and I think there are a lot of questions about COVID-19. There's a lot of misperceptions, and there's a lot of just questions that the general community has that they really want serious, and they want just the facts about what is really happening with COVID-19. What are the types of remedies we have for COVID-19, and what should we expect, both physically, mentally, as we move forward and progress with this COVID-19 that we're currently working on. So I'd like to begin. We have several questions, and we had lots of questions come in over the last several weeks when we announced this. And I'd like to start with Dr. Fennelly. Dr. Fennelly, can you talk to us about what we know about how the virus is transmitted? And can you specifically address what role children and schools play in that transmission?
Thank you. Thank you again for the opportunity to be here tonight and to address some of your questions, concerns, and sort of confront that with facts. COVID-19, or the virus that causes it, SARS-CoV-2, it's a respiratory virus. It's a coronavirus. Coronaviruses have been around in the form of common colds forever. This is a different sort of coronavirus. It infects through the respiratory tract, through the nose, through the lining of the eyes of the conjunctiva. Fortunately, it cannot be transmitted very easily orally or by mouth or food to mouth or fecal oral as it's referred to. So what we're doing currently, and what I think we all do extremely well in El Paso, wearing masks, is going a very long way to help us reduce the transmission of COVID-19.
So in your role, can you address what role children and schools play in this transmission?
Sure. So early on in the epidemic, we had reports out of Wuhan that children didn't get infected that much. Children usually weren't the primary case in a household. That was largely because in China at the time, schools were closed because of the Lunar New Year, and they didn't reopen. So in China, it was relatively easy to enforce school closure. In New York City, where I just moved from in early August, we were aware pretty early on that children without any signs or symptoms could be infected. Many hospitals in the area implemented routine testing for any hospitalized child. We were surprised to find out that about 50% of children that tested positive had absolutely no symptoms. So yes, children can be infected. There was a myth early on that children cannot be infected. Children do not get sick. Children absolutely can be infected. They can transmit it to more or less to the same degree as adults, perhaps a bit less. Do they get as sick in the balance? They do not. They can. There have been children that have died, including locally. For the most part, they have underlying conditions that would predispose them. Rarely, about 1 in 200,000 or less, children can get a severe inflammatory syndrome, but the good news is the majority recover. So bottom line is, we need to be aware of the fact that children can spread this. As we look to reopening schools, we need to find a way to do that safely. And within households where there are people that are vulnerable, particularly multi-generational households with grandparents that may be ill and infirm, we need to find a way to protect them.
So I'm going to move over to Dr. Molokwu. I feel like at the beginning of March, everyone believed that people under 30 and under were unlikely to catch the virus. What do we know about that now? Now, especially as universities are opening up. And what would you ask the young adults in our community to do to stop that spread? You're muted.
I do this all the time on my Zoom meetings. Thank you again for having me on. And so like Dr. Fennelly said, when the virus first started, it was very prominent in the news that the people most at risk from severe disease or dying from COVID were older individuals. And I think that people took that to mean that young people were immune from the disease. And so they got this sense that, oh, well, it's only old people. We can remember that some of the earliest outbreaks in places like New Jersey and New York, where we had COVID decimating nursing homes, they got this sense that young people were relatively safe. But we know now from recent data from the CDC that says that actually young adults are the highest new cases of COVID currently in the United States, and that they have the most cases of COVID. And so we know that that fact has been proven to be wrong. And because younger individuals are much more mobile, young adults who are working, who go out and interact with each other, college campuses, young adults socializing, they're more likely to gather in large groups and are therefore more likely to transmit it amongst each other. And while young adults are less likely to have severe disease, be hospitalized, or die from COVID, the problem is especially in places like El Paso and in with a lot of minority groups, we tend to live in multi-generational homes, right? And so we have multiple family members, and the young adults have to think not only about their health and their risk of severe disease, but also about who they live at home with and the risk of transmitting it to those individuals. And to answer your second question about what young people can do to help that, is that they should remember that they are preventing not only disease for themselves, but diseases for their parents, their grandparents, their tias, their uncles, every other family member. And so that when they go out, they practice all of those things that we've talked about. Don't gather in large groups, wear your face mask, be 6 feet, stay with 6 feet separation from each other. If you are sick or you're feeling unwell, quarantine yourself and get tested. The sooner you know that you have COVID, the sooner you can start taking evasive actions to spread it to other people.
You know, that's an interesting concept. So let's say somebody goes somewhere and there may have been a group of several people. We were just talking about how people are getting really anxious about just being at home, and so they're starting to gather, even though it goes against all public directives. People are starting to gather. So let's say you went to one of these. What should you do? Like if you went to an event and there were several people, let's say 20 people, 10 people, but you're thinking, oh, nobody had COVID. What should you do when you leave that event and let's say go back to your family? What should be the things that you should be doing at that point? Should you like isolate? Should you wear a mask? What would you say is the best thing that you can do if you find yourself in that situation?
So I'm going to give an example of what we would do in a workplace situation, right? You do need to try and separate yourself from other people. It's difficult in homes because not all of us have large homes and have enough space to separate. But if you are not going to be careful, don't aggregate, wear masks when you're outside and interacting. It may be helpful, especially if you have people at home that are at risk for severe disease, to think about adapting your behavior at home to reduce the risk of transmitting it to those people who are at home, if in fact you were to become infected with the disease. So try not to share utensils, try to stay 6 feet apart from each other. Where that's not possible, maybe wear a mask until you know that it is unlikely that you are sick. You know, for example, if you say go for a concert, I don't think any of those are going up and you're packed with people. It may make sense if you live in a house with your parents who are elderly or not even so elderly but have multiple comorbidities, or your grandparents live with you, to try and adapt your behavior at home to prevent those people from getting the disease if in fact you were to get ill.
Right. And so speaking of those things and what's going on in El Paso, Wanda, I'd like to talk to you specifically about what's happening in El Paso. We've seen 500 deaths recently. What other trends are you seeing in our city? Are we seeing fewer or more hospitalizations, fewer or more cases of different symptoms? What's going on in our community right now?
Well, right now we are seeing more hospitalizations. So we are certainly watching that, watching the hospitalizations in our medical surgical units as well as our intensive care units, and the number of ventilators that are being used to support these individual patients. So that is, has creeped up over the last week or week and a half. We can't really say at this point that that has to do with a Labor Day bump. We have seen that in the past on the other holidays, but it's probably a little too soon for us to say that. We do have the situation of schools that are, we have more schools that are opening up, and Like anything else with any school, that means that people are out purchasing supplies that they need and those sorts of things. So we have this just natural kind of increase where we're around people that we wouldn't normally be around. I think we'd all sort of gotten used to identifying our bubbles. We have our family bubble, and we are careful around those individuals, and we all typically have a work bubble where there are people that we work with every day. And not that we're suspicious of people not in our bubble, but we're careful of people not in our bubble, or at least we should be. I do think there is fatigue. There's COVID fatigue. And so people do get lax about when they wear their masks or not. And sometimes you think you're just going to run into a store to get something, and you happen to be standing in line with lots of people that you had not anticipated. Unfortunately, some of it has become political, and it has, I think, removed our common sense in some situations about what we should do and should not do. As far as the symptoms go, I don't know that we've really identified any new symptoms. I think everybody's been very clear what those are over time. What we are seeing, however, is that we have more and more individuals who have not gone to the hospital fast enough. And because they were afraid they would get COVID at the hospital or whatever, despite the fact that the hospitals were taking great care in the emergency settings and also on their nursing units to protect the patients as well as their staff. And so we have people reporting to hospitals very late in their symptomology, and that makes it much more difficult to treat. If you're having chest pain, or if you're having signs and symptoms of a stroke, if you don't get there fast enough, you are excluding yourself from a lot of treatment that could completely change your life going forward. So we're concerned about that, trying to make sure that we let the public know that they should go forward. The other thing that I think is become very clear is almost anything could be a condition that puts you at risk. We hear a lot about high blood pressure and diabetes. Well, that pretty much describes El Paso. And so we have a large population who have comorbidities that really do put them at risk. So that's why we're asking them to really watch those things, watch your bubble, wear your mask. And if you have those symptoms, you should go to the hospital and be checked. We'll take good care of you.
So that's really important, because that's one of the things that I think a lot of people don't understand is what is an underlying health condition. They assume it could be diabetes, but being overweight, and that's an underlying health condition that I think a lot of people don't take into consideration. Can someone talk about what that means, like being overweight? Because I think people think being overweight, being morbidly obese, but really it's not just morbidly obese. Could you address that?
I can, or I will let any one of the physicians step up. But yes, you are correct. There are a number of underlying conditions that put you at risk. And it is being overweight. You're right. You do not have to be morbidly obese. We have a lot of individuals in our community that have respiratory ailments, asthma, COPD, as I said, high blood pressure, diabetes, people with pre-existing cardiovascular disease. I think as we come out of this, we're probably going to know a lot more than we know now as far as what those risks are and what type of repercussions there will be medically going forward. We really don't know, if you suffered from COVID, what type of longer lasting cardiac problem you may have. We just don't know those answers yet.
So we do have a question, and I'll talk to Dr. Martin right after I ask this question, because it's related. But one of the people that is on the chat asked about their children who have asthma. I don't know if which doctor would like to respond to this in terms of they talk about the fact that children are asymptomatic, but Crystal Rodriguez has children that suffer from asthma and wants to know what the correlation is between COVID-19 and asthma, and if you could address that particular question. Go ahead, Dr. Fennelly.
Yeah, thank you. It's a great question, and I think the assumption is that as of now, there is not strong evidence that asthma in a child per se will predispose to severe COVID. So that's the good news. On the other hand, what's been mentioned about being overweight, that extends across the lifespan. So even in young adults, older adolescents that are overweight, that per se would be a risk factor. A child that's on chronic steroids, taking prednisone all the time for whatever condition, that might be something you want to check in with your primary doctor about, to ask the question whether that could increase the risk.
So I'd like to move over to our conversation with Dr. Sarah Martin. Anxiety, oh my Lord. So this morning I just did a video for our YWCA staff about anxiety and stress, and I freak out even when I'm going to the grocery store. I get a little stressed out just walking in thinking, okay, is everything clean? So can you talk to us about anxiety? Can you talk about depression, especially as people have been confined in, very closed communities over the last several months? Talk to us about mental health and what's going on with COVID in relation to mental health and anxiety and depression.
Okay, do you want the good news first or the bad news first?
Let's start with good news. It's always good news.
That was what I was hoping you'd say. Okay. The good news is that for whatever reason, and I'm sure we'll write many papers later on, but for whatever reason in El Paso, the suicide rate is decreased significantly, like almost 50% for some reason, during the time of COVID as compared with last year at the same time. So March, I have the stats from March until early July. And so I compared it to last year's stats, thanks to the Office of the Medical Examiner. And for some reason, now a lot of people are worried about, that's the worst outcome, of course, if you're talking about mental health, is suicide. It's a horrible thing. It affects so many lives all around the person that commits suicide. And so everybody in mental health and a lot of other people too are worried that our suicide rate would go up. So at least in El Paso, that isn't the case. In children and adolescents, the numbers are so small, we can't really say one way or the other yet. But for adults, it's very clear that there's many, many fewer suicides in El Paso this year as compared with the same time period last year. So that's the good news. The bad news is what you're talking about, Dr. Acosta, that people are running around probably with a higher level of baseline anxiety than they're used to. But there's also good news that comes along with that. The good news is that people are very adaptive. That's kind of how we have taken over the planet. We can adapt to so many different situations. And so people have done a great job. People have done a great job. And for whatever reason, it's not pushing us over, at least here in El Paso, over the edge. I read every once in a while, I check up on suicide and COVID, and nobody's publishing anything yet about the actual numbers because they like to wait longer. They like to have more data before they publish something. But the early data from March until July is looking great. One thing I think people need to hopefully understand is that there's different levels of anxiety. Some requires treatment and some is just normal life. So you guys want to hear a little bit about maybe how to differentiate between just the regular stress of daily life and what you need treatment for?
Yeah, absolutely.
Okay, great. So really, psychiatrists at least look at it as all about functioning. If you are still doing your job, you're still, like for a kid, your job would be going to school and doing your chores. For an adult, your actual job. But then we also look at relationship functioning. We see that just as important as your occupational or other types of functioning. So think about when you're thinking about, okay, am I so anxious I need to go see somebody about it? Think about how you're doing. Is your marriage just as good as it was before? Is it suffering because of the stress and anxiety you're having, or your depression as well? Because that definitely affects relationships. Are you able to get as much work done? Now, I tell you, I'm not, the technology and technological problems, that maybe I'm not quite as productive as I was before, but overall, I guess I'm still going to work every day. I'm still seeing the patients. That's all. And then so there's that. That's the technical definition of having an anxiety disorders, if your functioning is affected. But then there's the other side of it. Are you happy? Is this decreasing your happiness to the point where you feel like, I'm just not happy anymore? You don't have to wait until, you get a divorce and you get fired from your job to get treatment. No. If you're feeling anxiety and you haven't been able to adapt to this, oh, believe me, you're in a boat with tons and tons of other people, and you can get treatment if you want. Now, the stigma against identifying yourself as a psychiatric patient or asking for help with psychiatric problems is huge. It's getting less every year, but it's still very significant. So hopefully, people are talking a lot about anxiety and stress and COVID. It's in the news all the time, and I have never had so many reporters asking me these kinds of questions. So hopefully, I'm all about good news. Another piece of good news is that people are ready to talk about it now. They're ready to see what they can do to prevent themselves from, going downhill. And oh, geez, there's my husband's lawnmower. I hope it's really loud, but hopefully you can still hear me.
Can't hear it.
So hopefully people are able to adapt mostly, but if they aren't, then I'm hoping that because it's in the news all the time, people will be able to reach out for help. And there's all different kinds of help. There's things you can do yourself at home. I think getting outdoors is one of the best things we can do, especially when you live here in El Paso. The weather is terrific. I have spent a lot of more time outdoors than I used to on purposefully, because I'm worried that I will get a little anxious or more depressed, not having those social relationships. Now, here's another piece of kind of interesting news. Especially now, I'm a child psychiatrist, so I'm speaking more on the child side, but kids, every person has their own level of social interaction that for them supports their best mental health. And so people probably never thought about it much before. They'd either, if you're a little kid, you had to go to school and spend all day, every day with other kids and a lot of other kids and a lot of demands during the day. And so some of the kids that we are seeing in our clinics are actually like a virtual school because the social pressure is off. Then there's the other type of kid that loves to be playing all the time and interacting, and that really supports good mental health in that person. So we're seeing differences in terms of what type of interaction level a person's comfortable with, or a kid, especially a kid, is comfortable with. And so that might be another thing you can do at home to support your best mental health, is to think about, okay, what's the minimum amount of social interaction that I need to be mentally healthy, emotionally healthy, and try to give yourself at least that minimum amount to maintain your resilience. And sometimes it's hard to tell, but maybe we like logs, keep a little log of, this week I left the house 3 times and I still felt really lonely. The week before that, I went out 5 times and I felt pretty good that week. So look for correlations in yourself like that. And almost no one does well if they're completely socially isolated. So if you're a person that lives alone, you especially need to make that effort, I think. And then if it's to the point where you're feeling suicidal, you're so depressed that you can't get out of bed and function at all, you can always access services here in El Paso. We have a Emergence Health Network has a crisis line. Just look up, crisis line, El Paso mental health, Google it, and you'll find the number. But then if it's a true emergency where you want to die right now, something that severe, you can always call 911. People think of 911 as like fires and crimes and heart attacks, but it's also the El Paso Police Department and the fire department have done a lot of extra training in mental health crisis, and they do a great job, much better. I used to be in the Army, and military police, a lot of times they wanted us to take care of all the criminal problems, and the El Paso police is very good. They're very good at differentiating between a criminal problem and a mental health problem, which is terrific. But you don't have to be, you know, if you feel suicidal, you just call 911 and they'll come help you. And it's usually the fire department that gets there first, because I know sometimes people, they don't want the police at their house. But everybody likes a fireman, right? Firefighter.
Those firefighters are like, they're everybody's hero. You know, I mean,
Yeah.
everybody, and they love when the firefighters show up. So in regards to mental health, physical health, and then visiting with doctors, when you're not, let's say you're not going to a psychiatrist, let's say you're going to your pediatrician, you're going to your family doctor, how do you address that? How do you tell your doctor, and how do you express, like, if a person's feeling this anxiety, but they don't want to feel like, well, I don't think I'm going crazy, or, oh my God, I don't think I'm that depressed. Like, when should a person speak up and tell their doctor that something's going on? And how do they address that with doctors? And how does a child do that?
Right. Okay. So for children, it's mostly parents that have to notice something. And what you're going to notice first is that your child is crankier, cranky, irritable, maybe crying more. And those are signs that can tell you about both depression and anxiety. And so simply making an appointment with make an appointment with the pediatrician or family medicine doctor or your PA, your nurse practitioner, and just tell them my child is crying more, they're more irritable. That's almost always the thing that you see first. By the time you get to their grades are dropping, that sort of thing, then you really need to get to your primary care provider. And we're so lucky in Texas, because we have a new initiative that the state of Texas put into the budget to support primary care providers in learning about child psychiatry and illnesses and diagnosis and treatment. But then also we have a hotline where primary care providers can call us directly. And this is not just El Paso, this is all medical schools in Texas have a region of Texas that they are responsible for. And of course, Texas Tech is responsible for our region from here all the way down to Eagle Pass. And so we are trying to get everybody on board to call our hotline and say, so if you have a kid that shows up and say, oh my gosh, my son is just cranky all the time now, he just doesn't seem happy anymore. And then we're helping those providers to decide what sort of treatment we should recommend first. Sometimes it's medication, sometimes it's therapy. Sometimes we do hear about situations that we really look at as they're having a bad week. Why don't we wait a couple more weeks and see if they're able to cope on their own? But those are the kinds of help that we can give primary care providers as the Department of Psychiatry and Child Psychiatry at Texas Tech. So
we had a question come in through the question and answer function. And what are your suggestions to work against stigma of seeking mental health support with cultural and intergenerational obstacles and approaching it with our, Monica says, our abuelos, tios, elders, etc.
Addressing
The stigma through intergenerational stigma of seeking out mental health support.
I mean, I'll tell you, and probably the other, especially Dr. Molokwu, because she has practiced here in El Paso for a long time. We get a lot of grandparents bringing their grandchildren in because they're having these types of issues. There's definitely a set of grandparents out there that have noticed it, and they have asked for a referral, or they have talked to their family medicine, pediatrics department providers to what to do about this. A lot of times, if the child doesn't want to talk to their grandparent or the parent about these problems, most kids will still go with you to the appointment if you make them an appointment, and maybe they'll talk to the provider. A lot of pretty much all primary care providers and child psychiatrists, if the kid and their family member shows up in their clinic They will give them a chance to spend time with the provider alone so they can express any concerns that they don't want to express in front of the other person. But what we really try to help people with is to look at any kind of mental health concern as just a regular medical concern. And that's part of the reason why I'm glad that we have funding for these programs to support primary care, because if you are being treated at the pediatrician office, it is going to be easier for both the kid and the parent or grandparent that's bringing them in to see it as a medical illness. Like if you go into Dr. Molokwu's office and you tell her that your kid is feeling depressed, she's going to talk to you about it and she's going to figure out what to do. And she's a real medical doctor. She's a real doctor.
Yeah, we had another question actually. So I don't know if it would be Dr. Fennelly who might be able to answer this. When back in March, you would go to the grocery store and the vitamin section was completely cleared out. Like, is there any evidence that certain vitamins or minerals or certain things where people can do to it, maybe not prevent it, but make it less severe if they catch it?
Right. So yeah, I mean, when I think of evidence, I think of placebo-controlled, double-blind study. So bottom line is that there is no evidence, zinc, vitamin C, what have you. Certainly malnutrition per se, rather severe or moderate malnutrition probably could predispose, but quick response is no evidence.
I think they just picked that up when they picked up the extra toilet paper.
Yeah, because we've heard, take these vitamins and take these vitamins and take these vitamins.
No, there's no question. I think in terms of our general state of health, it's important we take certain vitamins and keep good supplies in case of if we can't get access. But basically, there is no evidence.
So vaccines, there's a question about vaccines. Is there a vaccine? When is the vaccine becoming available? What should we be doing? What about the flu shot? So there's a lot of those questions. Can you address and it could be that Dr. Molokwu also talk about flu shots. Let's talk about vaccines. Where are we? I know that Dr. Fennelly is an expert in vaccines. So let's talk about flu shots and what are you seeing out there in the medical community? Are people taking their flu shots? I know a lot of people are worried that people are going to just stay away like they did from hospitals, but stay away from taking those flu shots as well. And what are the recommendations?
Right. I'll respond very briefly and then let my colleague, Dr. Molokwu, pick up on the local usage and uptake of the flu vaccine. But yes, there are vaccines available. Two major candidates. One is adenovirus-based as it is. Adenovirus is sort of a form of the common cold. The other is sort of just taking genetic information and injecting it and letting the body make the proteins. Both are very, very promising. They're undergoing rigorous studies. And as my guru, M.P.H, has said repeatedly, there will not be a vaccine that is approved. It will not be approved unless it is, number one, safe, and number two, is effective. And I get a lot of encouragement from what I see from the preclinical studies in animals and some of the human study data that's coming out. In terms of a timeline, don't know, but please, once it's available, we know it's safe, please take it. I'm very concerned about the polls or the surveys that show only 1 in 2 people would take it. To me, that borders on absurdity. We need to be reassured. We need to trust in that system. What's missing here thus far are trials in children. I understand that we need to show this to be safe and effective in adults first, but children will continue to be a reservoir for this virus. So I think that's going to come within the next year. We'll see pediatric trials, and potentially we may be able to allow access for our community to those trials early on. The flu, there was pretty strong evidence going back to early March of this year that rates of flu were dropping. Year over year, seasonal flu, it was dropping. Why? Most likely because we were beginning to social distance even before it was mandated by our governors and mayors, and we were beginning to wear masks. So I think that trend will continue. We're going to see fewer hospitalizations. I've already gotten my flu. My wife will get her flu shot as soon as we're insured under Texas Tech on October 1st. And I'm eager to hear from my colleagues what the trends are in terms of people getting the flu otherwise locally. Thank you.
So anecdotally, I would say that I have a lot more of my patients walking in and actually requesting their flu shot very early on, a lot more than I would see in a normal year. I used to have to do a lot more arm twisting to get people to get their flu shots. And I'm seeing that people are more likely to walk in and just ask for their flu shot while they're in their visit for other things, which is great. I always stress to them that the flu shot will not protect them from COVID, but unlike earlier in the disease where we thought that it was unlikely that you would be infected with COVID and flu or strep all at the same time, because that was one of the kind of rule out criteria. If you came in with a fever, we'll check you for strep or flu first. And if you were positive for any of those, we're like, this is unlikely COVID, and we would focus on that. Now we know you can be infected with both at the same time. And so I'm very sure that nobody wants to be battling flu and COVID at the same time. So the disease that we know that we have something that's effective to prevent, I think it's important we all get our flu shot and kind of get that put to the side, so to speak, while we're preparing for hopefully an effective vaccine against the coronavirus.
I would say the city of El Paso has a very assertive immunization plan this year, and they're going to have a lot of places where you can go and get free flu shots. And so I think right now the number is 212-4-FLU, and you can go and they will tell you where, they'll tell you where the sites are going to be where you can go and get free flu shots.
So one of the things
before your insurance is up, I can give you a place.
Okay, great. I'm going to go get mine. So one of the things that I've been worried about is vaccine trials in communities of color, to make sure that whatever the vaccine, are there vaccine trials going on in El Paso? Are there vaccine trials specifically focused on the Latino community, on African American community, and those communities that have been greatly impacted in terms of death from COVID-19?
I think that that's a fantastic question. And on a global level, there's a real concern that the nations or the populations that need a vaccine the most may not get it. Although there are plans already. In India, there are plans to produce already, I think, upwards of 500 million doses of the AstraZeneca candidate to make sure that it's available, affordable for certain countries, certain populations. There's a lot of interest in bringing vaccines to the El Paso area. There have been a lot of overtures. We're not quite there in terms of infrastructure yet, but part of the interest is because we have a large proportion of Hispanic Latinx community, a lot of interest in that. And yeah, I think as much as possible is being done to make sure that these trials are representative of those populations. The second part of that is the elderly as well. We need to make sure this works in the elderly, and that's afoot. But as of right now, there is not a phase 3 trial available locally.
And just to buttress that point, I know that earlier, Dr. Costa, you had talked about the YWCA and your push to look at disparities in healthcare when it comes to race and ethnic minorities. And unfortunately, this whole process to develop the vaccine also is one of those things that highlights, that will unfortunately continue to highlight the racial and ethnic disparities that we have in healthcare. Traditionally in the African American community, not as much in the Hispanic community, but to some extent, there has been this long-standing distrust of medical institutions and trials, dating back to, at least in medical literature, the well-known Tuskegee trial and other trials like that. And so that has contributed to the difficulty in recruiting ethnic minorities into trials to make sure that vaccines or drugs are equally effective in all groups and will react or work the same way. That being said, I do think that as healthcare providers, and for us in a place like El Paso, where we do tend to have a majority minority type population, that those of us that are in medicine, in research, need to really work to educate and reach out to our communities to make sure that people of color actually participate in these research trials, because if we don't participate, nobody else is going to develop these drugs and vaccines and interventions that will help our communities if we're not actively involved in it. And so that's the reach out and education that we try to give our patients and our communities, that we need. A lot of safeguards have been put in place to make drug trials and vaccine trials safe for all of those involved, or as safe as possible for all of those involved, and then more of us should participate in research trials.
So Wanda, I have a question for you about rapid testing. So COVID testing, there's been some I guess in the news, the fact that people are starting to test less, like they're just not going to test as much as they were previously. And there's also been some commentary about there's rapid testing that the results in 15 minutes. How effective are those rapid tests in comparison to the traditional tests that people take?
There are a lot of different tests out now. There's the traditional PCR that we've done for some time, but there are a number of different manufacturers that have rapid testing out now, as well as antigen testing. There's a lot of different tests that are going on. In some cases, they would tell you that they are very effective. I think it sometimes depends on the setting. In some cases, some of the facilities had moved to rapid testing and now have reverted back to PCR testing. Dr. Fennelly can probably speak more to that than I can, but certainly in some cases, basically it told you that you probably needed to have another test to verify.
Right. Yeah, I think that's really the gist of it. The other part of this, though, is that some of these tests, particularly antigen tests, that could function like the strep test you may be familiar with that your children may get in the pediatrician's office, a pregnancy test, those have been developed. They may be, if you will, they may be somewhat insensitive, but when they're positive, it indicates there's probably a lot of virus there. So they could have a role in terms of identifying people that are likely to be contagious. Same can be said about certain of the PCR-based tests that are somewhat insensitive, but when they're positive, meaning it just takes a few cycles to amplify that virus, there's probably a lot of virus there. So I think we can do a lot more on the public health front. We need more organization regionally, nationally to put these tests in the right context, and in time potentially have a home-based test where we could do it to identify those among us who are infected and contagious.
I think one of the important things is when to be tested. I can't tell you the number of individuals that have called who ran into somebody yesterday who was positive and they want to be tested today. And so we have to explain to them why that's probably a wasted test. And so I think that's a huge issue.
Can you elaborate on that? Because I think that happens all the time. They run into somebody and they're like, I'm gonna go get tested tomorrow. You're like, wait, it's not gonna show up yet. Can you talk about what that waiting period is and why it makes sense?
I'm gonna let Dr. Fennelly and then I'll tell you how I explain that too.
Yeah, I mean, the incubation period, oh my goodness, the incubation period would be what, a minimum of maybe 5 days? Yeah, 5 to 14 days. So you might pick it up on day 3 or 4 with a more sensitive test. But that's a tough one, and that requires a certain degree of education and maybe, simplifying the guidance.
Dr. Molokwu, would you like to add to that?
I mean, so what we are recommending for a lot of individuals is to wait at least 3 to 5 days. after a known exposure to test, so that we increase the sensitivity of that test, because there is a risk to testing early. And so once you have a known exposure, the best thing you can do is, in the meantime, quarantine yourself, try to separate yourself from individuals to reduce the risk of spreading it if in fact you are positive. Because if you're asymptomatic, getting the test the day after doesn't necessarily help you. There's no additional treatment that we're going to do. We're still going to tell you the same thing, which is rest, hydrate, quarantine, and stay, wear a mask so that you don't infect others. So what is in your best interest is, we don't want you to be falsely negative and running around infecting people because you've assured yourself that you're negative, only for you to become symptomatic 5, 6, 7 days after you tested, and then have to retest again for something that is still, unfortunately, a somewhat scarce resource, which is testing availability.
So we're saying, I just want to be very clear. 3 to 5 days would be, preferably 5 days, but 3 days after exposure, that's the minimum. So that people aren't going the very next day, like they saw somebody and the next day they're going to go get tested. So they should at least wait 3 days. 5 days is what's recommended. Is that correct? Okay, well, we're about to wrap up. So I'd like to ask you for your final thoughts. Any thoughts you'd like to share? Any comments with our audience? Any misconceptions you want to share? I'd like to start with Dr. Martin.
Misconceptions in terms of like the mental health and COVID, and I mean, I think that most people are assuming that this is going to take a huge toll on people's mental health, but I just want to emphasize that humans are extremely adaptive. They have adapted more quickly than any other animal, and that's what we are. We're just animals. So we're doing a great job at it. Not everyone adapts in an equally quick way. Everybody takes their time. So just give yourself time to adapt to everything that has changed, and really think about what you need in terms of having a happy life.
Thank you. Wanda?
I don't know that it's misconceptions so much as trying to deal with the rapidly changing information, because we didn't know anything about this virus. And so I think the fact that some of the criteria changed so quickly, I think people became distrustful that we didn't really know, and we didn't really know, and we're sorry, but we didn't really know. And so we are very adaptive, and we'll be able to get through this, but understand that we're going to learn things tomorrow that we didn't know today. And the last thing I would say is wear your mask.
Thank you. Dr. Molokwu?
Oh, there I am. So I actually saw an interesting question on the chat that is this discussion that I have with my patients all the time. So on the one end, there are people who avoid testing. On the other end, there are people who want to be tested all the time, even when they're asymptomatic and they have no exposure. And I try to explain to patients, you may feel better because you got tested yesterday and you're negative. But being negative doesn't buy you lifetime immunity from getting COVID. Your exposure tomorrow could put you at risk of having contacted COVID, and your negative test yesterday doesn't mean anything. So the most important thing for all of our peace of mind is to follow the public health directives. We know that masks work. In hospitals and clinics where we have to take care of people who are sick and have had exposure to positive, COVID positive patients who didn't know they were COVID positive at the time they're coming to see us, we have not seen a lot of transmission where the provider is wearing a mask and the patient is wearing a mask, even though we have been in the same room. So when you are out in public, wear a mask. Encourage those around you to wear your mask. Wash your hands when you're touching. Try to maintain a safe distance from each other. Avoid large, crowded, closed places. Being out in the fresh air and out in the community is good. It helps your mental health. It helps to exercise. It helps your overall health. And just follow the directives for what we know in public health can help to prevent getting an infection with coronavirus.
Thank you. Dr. Fennelly, you'll have the last word here.
Okay, I'll be very brief. Again, thank you for the opportunity. In terms of misinformation, one might be we don't have lifelong immunity. I think we will have immunity that can protect us once we recover, but we still need to be safe. I want to end on a positive note and say that, before coming here, my wife helped design a study about mask wearing adherence throughout the country. El Paso came out near the top. I read about y'all on the front page of the New York Times. You had one of the highest rates in the country. I've seen it being here. I'm impressed with it. So keep on doing what you're doing. As been pointed out, you wear a mask, I wear a mask. We can beat this. A lot of questions on vaccine efficacy. We will be lucky if we get a vaccine that's as effective as those masks. So keep on masking. I'm eager to meet all of you face to face eventually, but for now, keep on wearing those masks. Thank you.
Well, thank you so very much. And I'd like to thank everybody that tuned in today and that participated and asked questions. We're sorry we couldn't get to all of the questions, but we appreciate you being here. We will have this video available afterwards if you want to share it with a friend or a family member. And the most important thing that we can do that we heard today is wear a mask. Let's all wear a mask and go outdoors and not be in enclosed rooms. So thank you to the amazing panel. Thank you to Dr. Sadhna Sheta for her support in this process. And thank you to each of you for participating today on our panel and for those of you that tuned in. And with this, we'll just say thank you and good night, and everybody have a wonderful evening and wear your mask. Thanks.
Thanks, guys.